Hey everyone, welcome to the Canine Culture Podcast, where we talk about everything dog. Q&As with veterinarian professionals, rescue operators, everyday topics. We cover everything dog on this podcast. So make sure you subscribe to the Canine Culture Podcast on your favorite podcast platform, and make sure you're following us on social media on both Instagram and Facebook. Thanks again for listening. Now here's that next episode. Hey everyone, welcome to the Canine Culture Podcast. This is your host, Brittany, and today we are joined by Nicole. She is a veteran of the podcast. She's an ER vet at Veg. So Nicole, thank you for joining us.
Yeah, thanks for having me again. I like doing this annual meetup that we have.
Well, this one is perfect for you, given that you are in emergency medicine, because we're going to talk about bloat. And recently, I've had a few friends whose dogs either had true bloat or the term was just thrown at them in an emergency situation. And so I thought, who better to reach out to than Nicole, because I know she probably sees it all the time. So before we talk about bloat, how often do you see it at your clinic?
Yeah, absolutely. And so I actually will kind of bloat, like the term is used towards any type of like stomach, like the true stomach, not like belly, like true stomach
Hmm.
has been all of a sudden full of something, whether it's food or and then it kind of breaks off from there. Is it a bloat as in they're truly fully bloated, or is it a bloat that they are now a their stomach has turned? And so people will call and be like, I think my dog's going through bloat. And the main thing I ask them is, what clinical signs are you noticing at home? Are they retching, like unproductively? Are they very weak? Does it seem like they're about to collapse? Can they not get comfortable? Or is it more or less like they look like they have a really big tense belly, but they're not trying to vomit, whatever the case may be? But usually, either way, I recommend that they come in because
Hmm.
food bloat itself and like air bloat itself of the stomach is not necessarily life threatening compared to
Hmm.
whenever it twists. And so most
Right,
people, when they're thinking of bloat, they're thinking of the twist. They're thinking of like,
right. And that's
mm-hmm,
GDV, right?
correct. Yep. And that's
Okay.
gastric dilatation and volvulus. It's just a really fancy word of saying the stomach is dilated because of air or food and it twisted on its axis.
Okay.
And so that is what a GDV is. And so bloat, that's where bloat kind of can separate into
Hmm.
both of them I see as urgent because usually the if a pet got into its whole bag of food, which is something that tends to be like my dog ate half of its bag of dog food and I'm like,
Yeah.
okay, well, it may not be in an emergent situation right now, but one, your dog's going to be uncomfortable. Two,
Right.
we need to monitor it, maybe give it some fluids, try to help the stomach pass that safely. But three, they are at risk of flipping. So it's if
Okay.
they're not at that point in time, the timer is not turned on yet. It's the minute the stomach flips. And it doesn't mean it's going to happen, but it's when that stomach actually flips on its axis that now the timer's running because blood
Hmm.
vessels are constricted. So I
Okay.
usually try to figure out which one it is. If someone comes in and they say, I think my dog has bloat, the first thing I'm going to do, other than a quick exam, is I'm going to take an x ray because that's going to
Hmm.
decipher between is it a really big bloated stomach or is it a stomach that's bloated and twisted? And now we need to get
Right.
them into like emergency surgery.
How often are you seeing GDV? Are you seeing it like once a week? Are you seeing it like once a month? Like, what's that frequency look like?
Yeah, I would say if you like averaged it out, across like because I feel like things in veterinary medicine we say like things come in waves. Like the other week we
Yeah.
had like three in a week and that but we hadn't seen one
Wow.
for like a month before that, and so I swear if cases come in threes or fours and then you won't see them for a little while. If we were to even it out throughout the whole year, I probably would say we probably see in our hospital alone like three or four a month. And
Okay.
then But then, next step is how many do we actually get to go in and do the surgery, or is there other complications or comorbidities or cost
Mm-hmm.
associated? But like a true stomach flip, probably like for a month.
Okay. And so some of those symptoms, swollen belly, which that one can be ambiguous,
Mhm.
restlessness or pacing.
Yeah. Most of
I'm
the time
trying to think of some
people
more.
Most of the time people hear that they're saying he's vomiting or he's like retching. And that is like that
Uh-huh.
heavy heave. And it's like a terrible noise that they make. It's a huge trigger for us as veterinarians, especially ER veterinarians. If we hear a dog like retching or coming in that's retching, we're all like, what is
Mhm.
that noise? Because it's like this really guttural sound. And it's
Uh-huh.
truly because the dog is trying to release the pressure in its stomach, but it cannot because it's twisted.
Yeah.
And a lot of times they're weak or like shaky from pain, but also because a lot of really important vessels like twist with the stomach. And so they
Mhm.
can't get some of that flow back to the heart like they need to. And so they're kind of weak, they're retching. Sometimes their actual color of like their gums will
Mhm.
be not pink. It'll be kind of like a muddy brownish color because circulation isn't good. So they majority of them come in and their stomach is really big. Like it looks, if it's gassy, it will look, people say you can ping it and it will sound like a basketball because it's like
Oh,
full of
wow.
air. So their stomach will be really big. I would say half walk in, the other half are like gurneyed in, depending
Mhm.
on the age of the dog, how long the stomach's been flipped, and like this overall severity. So I've been surprised. Usually they need intervention within like hours. The
Oh,
sooner the
wow.
better.
Okay.
But I have had some come in that walked in, they're like a 3-year-old, St. Bernard or German Shepherd or something, and they walk in and they walk in slow, but they still are walking in and you're like, "Huh." And the owner's like, "I don't know. They've just kind of been intermittently trying to vomit since last night, but they were like a little restless." And you're like, "Huh." And you take an x-ray and it's a GDV and you're like, "Holy cow, this dog's stomach
Mhm.
has been possibly flipped or like kind of back and forth flipping since
Okay.
last night."
Right.
And you're like, "How is this creature still alive?" And don't really have like answers for it, but I feel like they either come in, half of them are walking and they're like walking in, I'll bet like slowly, like you can tell something's going on, and then the other half are like are lateral or they need
Mhm.
assistance getting in. And there's different reasons as to why, but it's kind of just how each dog's body reacts to that actual flip of the stomach.
Right.
Yeah.
So let's talk about what causes GDV. And I know that can kind of be all over the place too. Let's start with a discussion around certain breeds. So I know certain breeds are a little more predisposed to GDV than others. So can you touch on that a little bit?
Sure. Yeah. So we see it more commonly with dogs that, like larger breed dogs, and dogs that have what are called keel chests. And so that's like when their chest is like really rounded and then maybe they
Mhm.
tuck up. So examples of that: Great Danes, Boxers, German Shepherds. So they're basically, they have a whole lot of room for the stomach to get big and flip. And so it's very common in those breeds, but I've seen it in Labradors, Labradoodles, like doodly things, everything that's like doodled, the larger breed. It's really what animal has room for that to happen, but we do tend to see it happen later in life. So I've seen it in 2-year-olds and 3-year-old Labradors that scarfed their food down really quickly and then ran
Mhm.
outside and got a bunch of air. And then now all of a sudden the stomach flipped. And I'll kind of explain like why that happens. But most commonly we'll see it in, I would say, like 6, 7 and older. And they're not entirely sure why. I don't know if things get looser, like, the ligaments that hold organs in place, like if those get looser, or if there's something else causing a weight to be like towards the bottom of the stomach. So essentially,
Mhm.
the way GDV happens is kind of how I explain it to clients too. Think of a blown up balloon, like an air balloon that has a little bit of like maybe sand, but then also like shaving cream and water in it. And it's full with gas, like halfway full with gas at the top. And then the bottom part of it is full of some sort of, like I was saying, like sand or something that's like sloshing around.
Mhm.
Essentially, the way the dog's stomachs are positioned, they're for the way that their actual like abdomen is. If they're running around and they have this heavy weighted bag with air on top of it, all of a sudden it like moves, and then all of a sudden it does a 180 flip on itself because the
Mhm.
way that the axis runs across the stomach. So everyone's thinking of like their own stomach, like my stomach's sitting like this. How could it twist? Well, they're more horizontal with the ground, and
Right.
so that allows the stomach to like get big, but then have that weight and flip around on itself. And it's just because of the
Mhm.
pendulousness and like the actual weight at the bottom of the stomach. So usually when we go in to correct it and we open up the stomach, there's usually a lot of like heavy, thick food that was in there that's like turned into like mush or gruel, just but like really heavy.
Mhm.
Sometimes there's like a cancerous mass that's like heavy or causing like a weighted distribution towards that
Mhm.
bottom part of the stomach. Sometimes even because the spleen is connected to the stomach, it gets its vasculature from the stomach actually. The spleen is often affected too, but if there's masses on the spleen, that can like whip it around. And so it's all
Mhm.
about what changes the actual weight distribution and then having gas on top of it. So that's where that Labrador comes in, right? Or that anxious older dog that just ate, but then maybe
Mhm.
you left to, whatever, go run errands, go see a movie, whatever the case may be, and he panted for like 2 hours straight while you were gone. And so there's still food in his stomach, but now there's air on top of it. So there's
Right.
this buoyancy. It flips compared to when there's just food in the stomach and not as like maybe he ate the whole bag of dog food, but then he sat down for like 4 hours and is trying to digest that. There's not food and gas. It's just food.
Mhm.
So it's kind of the the main way of explaining it to people is it all of a sudden it just like centrifuged its way around and now the stomach is twisted on its axis and I have to go replace it and tack it.
Right.
Yeah. So it can't
Okay.
do that again. Yeah.
Yeah. We had a run-in with not GDV, but a form of bloat.
Mhm.
One of our Pomeranians last year, very, very anxious, was panting very heavily, ate his dinner extremely fast, then proceeded to drink an entire bowl of water, went outside, sprinted around the yard forever. So it was the perfect storm.
Yes.
He came in, was panting so heavy, but he was just panting,
Mhm.
and just kind of laying there, which I thought was a little odd. And I was just, waited for symptoms, other symptoms. Nothing happened, but because the panting just wouldn't stop and his breathing was so labored, we ended up going in and they did x-rays. It showed just literally just a bloated stomach, but not flipped.
Yep.
And so after that, some of the things we kind of implemented at home were feeding in a puzzle bowl. So using like a slow feeder
Yes.
bowl for him so he wouldn't scarf it down, not allowing the dogs to play after dinner because Google said, don't let them play after dinner. I
I
said,
know.
okay.
Yes.
And
They're like
then,
don't play. Yes, I know.
yeah. It's
Yes.
kinda like when you were little and they're like, "Okay, don't swim for 30 minutes after you eat." Like, kinda the same thing as what we implemented at our house. So, do you think those are good tips with respect to, like, making sure your dog eats slower and then just, like, not playing after eating? Is that beneficial to prevent bloat?
It is absolutely. And I usually I tell people as well, so if they're already fast eaters as like puppies, and I would say this like in GP, like when I was in GP, get the slow feeder bowl. Like we need to learn to eat slower because
Right.
yes, they and then they drink a bunch of water and they go run around and now you have this heavy like gruel and then they're panting and then if they're the perfect breed for it, which I've had a dachshund have a GDV. Like, it's possible for any animal technically to get it, but it's the
Mhm.
ones that get it most commonly, the ones who have the room for it
Right.
and can make like that space technically for it. But I always let people know that keeping them eating slow, keeping them rested. Some people wonder why, if they ever take their pets to like daycare or grooming or boarding, sometimes the
Mhm.
daycare will ask, when did they eat last? And if you're like, well, they ate an hour ago, they may say, we're going to wait on playtime for another hour or two because your pet just ate.
Mhm.
That's actually like a really responsible thing for them to do, is because they're trying to avoid not just bloat, but like vomiting, and
Right.
complications that can come from that. And
Mhm.
so, but yes, I've seen it in all kinds of breeds of dogs, and, even German short hair pointers, which they also have the keel chest, and then Weimaraners and things that are nervous Nellies. Like, I've seen it in them
Mhm.
too, but that is a very helpful way to prevent it. And usually, if it happens once and the dog somehow miraculously, you didn't do major intervention, but the dog somehow miraculously like unflipped its stomach, it is highly likely it's going to happen again. So usually when I tell people it's happening once, we have to go in, we have to tack it, because more than likely they will bloat again, even with the tack, which is fine because that's not the emergent part. But
Right.
let's say we go in, or it was flipped, and then as you're getting them prepped for surgery, somehow it unflipped, or whatever the case may be, and you tell them, we still need to go in and do this because, one, I need to check and make sure all the organs are healthy, but two, it's more than likely going to happen again. Like, it's like an 80% chance that it's going to flip
Okay.
again. And that's that, especially in our older pets, we see that.
Mhm.
But and then with the older pets, sometimes people, like, I tell them, we don't always know why it happened. Like, he could have just been hanging out at home, but most commonly they had some sort of food in their stomach, and then there was some sort of increased oxygen, like swallowing. Aerophagia is what it's called. It's literally
Right.
air swallowing for
Huh.
some reason, and now we have like the perfect storm going on.
Mhm. So, whenever you are running those diagnostics, when a dog comes in with some of these symptoms, let's say you do an X-ray, will the X-ray always be determinative of whether that stomach is flipped, or are there times where you might need to do even more diagnostics?
The X-ray, I would say 95% of the time, it
Mhm.
gives you that idea. Sometimes it can be difficult because technically the stomach, usually it's a 180 flip, so it like flips halfway around, but
Mhm.
sometimes it can do a 360 and technically look like it's back in the normal position because it
Okay.
went full 360. Those ones are like very, very dangerous, like for the pet. So it's
Yeah.
like full 360. Um, but there's still things that go with it on X-ray that you're like, uh, this isn't just bloat. The spleen will look big because it's congested. There'll be gas in the intestines. The intestines won't be in the right position because they got twirled around twice. And
Mm.
so usually I would say X-ray is like probably 90 to 95% like confirmatory. And then on top of history, clinical signs, and we usually do check something called a lactate. And we check that in a lot of pets for a lot of different reasons, but mostly it tells us about perfusion. And perfusion is how well are we getting oxygen and blood flow to our tissues from your head to your toes? Is it coming back to the heart, going to the lungs, getting oxygenated, and then going back? And so whenever we have a twist that is cutting off some of that return, that venous return from the back end to the heart, that lactate's going to be really high. It's like running a marathon, which you may or may not have experienced lately. It's like running a marathon and feeling that burn and not being able to get enough like oxygen to those tissues. So essentially we'll check a lactate, and if that is high, like very high, then that's also pretty confirmatory, because with a regular bloat there is no obstruction of venous return. There might be like a little bit because the stomach's just like pushing on things, but not the same as
Right.
if you actually like twist that valve off. So that those things together, you pretty much can get like 100% this is like what's going on. The
Mhm.
hardest step after that is, how are things gonna look when you get in there, whether it's something that happened just immediately or something that happened hours ago. And that's like a discussion with the client as well, is the only way to know and save their life is to get in there. But sometimes we get in there and there's parts of tissues that have not been getting oxygen, and we have to decide what is the prognosis from here. I would say vast majority of GDVs that I have performed have been successful.
Mm-hmm.
Gosh, I would say if I was to put like some sort of ratio, like 9 out of 10 of them have been successful.
Mm-hmm.
It's the ones that we find some sort of cancerous mass or
Right.
other things in the abdomen that were comorbidities we didn't know of, or we went in and found, or the pet was just very, very unstable before going in. But there are times
Mm-hmm.
that there's parts of the stomach that has started that was oxygen deprived that you have to like remove and things like that. But I tell people vast majority of them do well, but there's all these other things that we have to consider, with like
Mm-hmm.
recovery and your pet's age, or does it also have these other comorbidities, or what do we do if we find this in there? It's just like a really big form of communication. But when it comes to diagnostics, you pretty much have it right then and there with a single lateral view, sometimes the
Mm-hmm.
lateral and like what we call a VD.
Okay.
Yeah.
And that's good to know that most surgeries are relatively
Hmm.
successful, because it does sound really scary,
Hmm.
especially given the timeline, and that some dogs have a matter of hours or
Yes.
hour. I feel like
Yep.
some dogs,
Yep.
things turn really quickly within that hour.
Yep.
So I think this is all just super helpful, especially
Yeah.
for people who, I think it's tricky sometimes to know, like, should I go to the ER? Should I
Hmm.
stay home?
Hmm.
Is my dog experiencing something that's just normal? And so I think just given kind of everything you've told us about the different symptoms, think about, did they just eat? Did they just go and run and play? Have they been anxious and just panting and taking an extra oxygen? I think all of that's really helpful for owners to understand, like, okay, this is time for an ER visit.
Right. Usually when I'm
Sorry, go
consulting
ahead.
people, I was going to say, usually when I consult people on the phone, because one of the amazing things about veg is you can call any veg in America and speak with a doctor. Like I
Hmm.
had someone that was in like Washington State or something like that the other day and called me, and she was like, I don't know how I got your phone number. I was like, I don't know, but how can I help you? And like, how can I guide you with getting your pet seen or not seen, or whatever the situation is. And so usually I let people know, if you have a concern, like I would bring your pet in, because I would rather me do an exam, find normal vitals, or even if it ends up like, I know we're talking about bloat, even if it ends up like their stomach was hard, but it wasn't bloat, like maybe it was something else, or maybe there's like back
Right.
pain, or there's something else that's going on that still needs to be addressed to help your pet. But you can call us, and that is something else that makes us different, other than like our open concept and pets and parents always being together with alongside the veterinary team, is that if you don't know, call us. And if a lot of times, and the teams are usually pretty honest about being like, oh, like it's okay if you wait to your primary care in the morning. But if there's something like they're like, I don't know, like I'm worried about bloat, I'm like, hey, bring in, you're worried, I'm worried, I don't want to miss anything. I would rather us just do an
Right.
exam and everything be perfectly fine and you sleep totally fine tonight than we miss something and we have like a bigger issue going on. And that brings a
Yeah.
lot of people at peace, because they're hearing it straight from me. They're not hearing it from like a receptionist, they're not hearing it from someone else. Like they're hearing my recommendation. But yes, and that goes same here too. Whether we're worried about it being bloat or whatever the case may be, if you're worried about your pet, we're worried, and we're open 24/7. So let's take a look and make sure everything's okay. And then if not, we're like on top of it.
Hmm.
Yeah.
Yeah. That's amazing. I love that Veg does that. And
Hmm.
now we
Hmm.
have one in Jacksonville. And so I don't want to use them, but if I have to, I will.
Yes, yes. That's the amazing thing about it, is just even sometimes it's hard for us when we're trying to talk to other ERs or specialty centers, and getting in touch with the doctor on call, or getting in touch with a specialist to chat with them can be really hard. But knowing that you can
Hmm.
call us and say, hey, this is what's going on, and know that you're going to speak to a veterinarian like quickly, is
Right.
so beneficial. And then also a lot of the times, then you've already made that connection with that veterinarian or with that practice. So when you walk in, we can be like, I'm usually like, hey, I'm Dr. Bertolini. I'm the one who spoke with you on the phone. And they're like, oh, okay. Like, that's so comforting. Like, I already have some sort of
Mhm.
relationship with you, even though you're in ER and I have never met you in my life, and you're like, hey, you
Right.
don't have to explain everything all over again because like we're on the same page, and it just helps build trust. And so
Mhm.
I love that we do it. I think it helps a lot, and it helps get those patients that may have waited in the morning till the morning into the hospital so we can help save lives sooner. But
Yeah.
yes, in general, when it comes to bloat, it's a big communication topic more than anything. But rest assured that if your pet comes in and we're worried about GDV, we're gonna take that X-ray. Like, we're gonna take them straight to X-ray, and we're going to get them initially triaged before being like, you have to deposit $1,500 or $2,000 before we can see your pet. No, if you bring your pet in and we're worried about GDV, the team is going to, with you, go to the X-ray, take an X-ray. The doctor's going to look at it immediately and say, I am worried that this is bloat. The team's going to start putting an IV catheter in while we discuss
Mhm.
prognosis, cost, recovery, how are things
Right.
going to be in the future? And so I think that is what is most important. And we're going to, if you say the word bloat, even if it ends up being a food bloat, we say, hallelujah, it is a food bloat.
Mhm.
Your dog don't feed it anything for 24 hours because it is
Right.
totally full. These are the options for it, whatever the case may be. And then if it's a GDV, then we're already getting things going as fast as possible to like stabilize and until we decide what the next step is like for your pet.
Mhm.
People do ask too if there is medical management for it. And I let them know, ultimately, no. I've had ones where I've gone in and they did unflip in the midst of getting them through because we're turning them on their belly, on their back, and
Right.
do things, and maybe it flipped back, but it's so uncommon for that to happen. But it's not recommended anymore for us to pass what's called an orogastric tube and try to get past the esophageal sphincter into the stomach when it's twisted because it can cause like perforations, if you
Mhm.
are trying to get past something that's closed. And ultimately, it's mostly no, we need to go in, we have to check and see what's going on and prevent it from happening again. So there really isn't a medical management. There's no medical
Right.
fix for it. It's only surgical, but we can, keep them we get them as comfortable as possible while we're waiting on those next steps and giving them things that they need that if we decide to move forward into surgery, which is usually a pretty quick like decision to make relative to certain other surgeries, right?
Mhm.
They're getting supportive care to make it as best of a outcome as possible, usually.
Right.
Yeah.
Yeah. Well, thank you for all of this information
Sure.
on bloat, true bloat versus just
Mhm.
stomach bloat. And
Mhm.
I think this will just be really helpful. I think a lot of people just don't really understand it. And like I was telling you earlier, I've had friends who are like, oh, my dog has bloat. And when I hear it, I'm like, oh my gosh, did they have surgery? What did they do? So
Mhm.
this is just really helpful. And so we appreciate you coming on again. And hopefully you'll
Yeah.
be a guest in like another year.
Oh, of course I will. There's always stuff to talk about. And I feel like I'm always very passionate about when it does, GDVs, things like that, stomach twisting, bloat. I am like a surgeon at heart. And that's why I also let people know about prognosis and always very honest. Like, I feel like veg
Hmm.
in general is just very honest. And so
Hmm.
it is one of those things that if you're worried at all about your dog's stomach either being full of food, full of gas, or full and twisted, just take it to the ER and let us
Hmm.
take a look, or take it to your vet. Just take it in to get that imaging done and make sure that that's
Right.
not what the case is, because like I said, vast majority of them do well through the surgery and recovery, but it is something that needs to be done with haste and with a team that is prepared to handle critical care management, which is essentially because your
Hmm.
pet's in like a critical state, and continued care after surgery. So usually they stay with us for 24 hours or so after surgery so we can make sure that they're healing appropriately, their pain's under control, they're eating, they're otherwise going to be set up for success when they go home, especially if we end up having to do a splenectomy, which is where we actually remove the spleen, which is like 50-50 if we have to do that. And so there's a lot that goes into it. So I always recommend it being a place that can continue monitoring them for a longer time after surgery, whether that's your primary care transfers you to a veg for continued care, or you do all of it through veg. Like it's still a big deal, It's like a lot for them to go through. You just tell people that's a pretty big deal. If your stomach was turned, you'd probably want to be in the hospital on some pain meds for a while too.
Right. Exactly.
Yes, but always happy to pop on here and and educate. I think that's one of the great things about my job and my career is the ability to do that and help save lives and pets when they need it most. And so I'm happy to come on anytime or anytime you have questions about anything. And like I said, if you ever need to talk to a doctor, you can call any veg anywhere. We can talk to you, and that way we can always advise what we think is best for the healthcare of your pet. Yeah.
Well, Nicole, thank you so much for being on again.
Yeah, you bet.
Thank you for tuning in to the Canine Culture Podcast. Please make sure you subscribe to the Canine Culture Podcast on your favorite podcast platform, and make sure you're following us on social media. If you have any recommendations, any topics that you'd like to hear, if you know of any guests that would be good for the show, or if you yourself want to be a guest, please reach out to us. Send us an email at canineculturepodcast@gmail.com or send us a direct message on social media. Thank you for listening, and please share this with any of your dog-loving friends.